Hello, my friends. Sorry because my live streaming video on my Facebook account was suddenly interrupted when I was talking about the issue of gynecomastia. I already talked about the physiological causes of gynecomastia, and also I talked about the drug-induced gynecomastia or the pharmacologic causes of gynecomastia. Which, as I defined it, is a hypertrophy or enlargement of the glandular tissue of the breast, not the fatty tissue, which is lipomastia or pseudogynecomastia, as we call it. But we are speaking about the enlargement of the glandular tissue of the male breast, which we call it the true gynecomastia. And I mentioned that the physiologic causes of gynecomastia and idiopathic causes form most of the bulk of the cases of gynecomastia which we encounter in clinical practice when a male patient presents to us complaining of enlargement of his breast, whether unilateral or bilateral. And then I mentioned also that the drugs which causes gynecomastia is a lot and form a great bulk also of cases of gynecomastia. That's why in any patient presenting with gynecomastia, we should ask about medications or drug history. Currently and in the past time, over the past several months or the past few years or the past weeks. So drugs. And I mentioned among the drugs the heart failure drugs, especially digoxin and all digitalis glycosides. Also some of the diuretics like spironolactone, which is aldactone. Also the peptic ulcer treatment drugs, which we used to use them in the past, especially the H2 receptor antagonists like cimetidine and ranitidine and famotidine and other H2 receptor or histamine 2 receptor antagonist medications used for treatment of peptic ulcer. And this was in the past before the era of proton pump inhibitors, which we use them now over the last decade and more and beyond. So asking about such drugs is very important. Also, I mentioned medications used for treatment of anxiety and depression. Many of them cause gynecomastia, so we should ask about them. Also, some of the antimicrobial drugs, especially the antifungal and antibacterial drugs, may also, many of them might also be among the causes of drug-induced gynecomastia. Also the INH, which we used to use it in treatment of in the triple therapy, classic triple therapy of tuberculosis as an anti-tuberculous regimen. The isoniazid or the INH is one of the causes of gynecomastia. We should ask in the history. And also some of the other substances or toxins like some of the addicting medications or some of the addicting substances, including marijuana, including amphetamines, including cannabis, including methadone, opioids. These are all potential causes of gynecomastia. Also, medications which have estrogen-like effects, or what we call xenoestrogens, which we are commonly included in the herbal medicines or in also in the skincare products, whether the skincare products used locally on the skin or systemically, they contain estrogen and estrogen-like substances, which might also cause imbalance of the estrogen-androgen ratio, systemic and local in the breast tissue, and cause and be among the pathophysiologic or the pathobiologic mechanism of gynecomastia. So we should ask about such xenoestrogens or estrogen-like substances which are hidden in some of the medications and substances used. Also, males using anabolic steroids as doping drugs or doping medications to increase the muscle mass and their muscle bulk. One of the side effects of the dopers of the doping medications and anabolic steroids, which are commonly used by such people, is gynecomastia. So we should ask about anabolic steroids, especially in people who are attending the gym and the